Hi, this is Marshall Davidson for Dopadoc.com. Today's podcast is Do I Have Parkinson's Disease? Diagnosis and Symptoms, Part 1. So the question comes, do I have Parkinson's disease? If you're asking yourself this question now, what are the reasons? Have you had difficulty with movement or balance? Tremor? Is the tremor on one side or both? Well, here's an introduction to the thinking process needed to make that determination, including a top 10 list of early warning symptoms. So, do I have Parkinson's? That's a very common search phrase that the Google search engine seems to come up with. And we'll just jump a little bit to a story about Michael J. Fox, who in his recent book, Always Looking Up, The Adventures of an Incurable Optimist, and of course, you know Michael J. Fox as a famous TV and movie actor who has Parkinson's himself and now is one of the most vocal and most successful fundraising advocates for Parkinson's disease. He describes his first encounter with Parkinson's. In 1990, he says he woke with a hangover after partying one night and noticed twitching in his left pinky finger. He was worried about it, justly so, and he consulted a neurologist who appropriately told him it was probably nothing serious. Maybe he'd been hit in the shoulder playing ice hockey. What tests could that neurologist have done on Mr. Fox so he'd have known that he had a more serious long-term condition? Nothing. Unfortunately, what was true back in 1990 is true today. No blood tests, spinal tap, EEG, CT scan, MRI scan. No tests can determine whether someone has Parkinson's disease or not. Not even DNA testing, which can tell whether you're kind of more likely or less likely to get it, but it can't make the diagnosis. The only two left standing there is a knowledgeable and skilled neurologist. And even then, the way the disease starts showing up and slowly revealing itself so variably in different people makes it very difficult for the neurologist to definitively make that diagnosis, especially early on. Research on finding better ways to answer that question earlier and with absolute certainty is underway, but has not yet yielded anything. Recently, a blood protein was found to predict who might be at risk for mental impairment down the road, but it's only good for patients who already have Parkinson's. Well, you may be wondering, isn't there a specific brain region that degenerates? Why then not just look at that with a very powerful MRI scanner? Well, even using the latest generation of MRI scanners, you rarely will see anything abnormal. Unfortunately, we're not talking about a big chunk of brain. It's only about 5 millimeters thick. And small as it is, it can be seen on MRI, but there's another problem. In this area is called the substantia nigra. But in most patients with the disease, this area remains about the same size. And the important dead cells, the neurons that produce dopamine, they get replaced by other scar-like brain cells that seem to appear the same on a brain scan. However, let's look at the disease in a little more detail. Maybe we can learn something that can help us in our own situation and our communication with our neurologists. So as I said, there's a tiny center of special brain cells that make up lots of the brain chemical dopamine on each side of the brain. This area, called the substantia nigra, only about 5 millimeters thick, starts losing its dopamine cells for no apparent reason. And doctors call that idiopathic, meaning they have no idea what the heck causes it. So this idiopathic death of nerve cells in this tiny area ends up having effects all over the brain. Why is that? Well, when these cells were still good, these neurons or dopamine cells that sit in the substantia nigra, they manufactured lots of dopamine. And like an array of microscopic perforated sprinkler garden hoses, they send out branches, these dopamine squirting projections all over the brain. They make so much dopamine that only 10,000 cells on each side of the brain are enough to supply an entire brain of about 100 billion active cells with more than enough dopamine to function. So there's two of these active substantia nigra regions, one located very deeply within each brain half. And they sit on top of the brainstem, sending out dopamine projections to many different regions of the brain. One area that has a huge role in controlling movement it needs a lot of dopamine to function adequately, is the area called the basal ganglia. It's an area made up of smaller movement control centers that's quite complicated, but it relies heavily on this dopamine supply to function normally. It sits deep within the brain, the area called the midbrain, and new functions are being discovered every day for this area. But let's just keep it simple. Let's just say for now that there's only two essential jobs that this region has, and it's not true. There are many other functions, but for now we'll say it's the initiation of body movements and then the maintenance of smooth movement once movement has been initiated. Both these jobs become severely compromised when there's not enough dopamine around. The basal ganglia, these neurons there, their brain cells normally take orders from higher brain. They take feedback from the body, they put it all together, and they send out coordinated signals to the brain areas in the higher brain that control the muscles of the body. And when dopamine is in short supply, these areas in the basal ganglia send out more and more disorganized and even random impulses to the higher brain areas that control the muscles. And it usually begins on one side, and this results in twitching, tremor, weakness, freezing or halting of movement, slowing of movement, loss of control, resulting in spontaneous movement, cramping, and a gradual loss in the ability to initiate movement. There's normally so much extra dopamine made that the abnormal movements start to appear only after 80% of the sufferer's dopamine cells have died. So even with losing this many brain cells in the area of the substantia nigra, it still appears intact on an MRI scan. Parkinson's, however, doesn't, as I said, just involve disordered movement. Many other abnormalities occur in the body and the mind. That's because these dying dopamine-producing cells from the substantia nigra also send these dopamine-squirting projections of themselves to other important brain regions. These other regions need a regular supply of dopamine to do their job correctly. One area, the hypothalamus, that regulates the automatic or so-called autonomic functions of many of the body, including the cardiovascular system and other organs, and cycles of sleep. Another dopamine-dependent area called the limbic system presides over emotions, desires, motivated behavior. Thus, the symptoms of Parkinson's involve many more abnormalities than just disordered movement. All these different potential malfunctions can occur in a different sequence to a different degree in each individual person who thinks they have Parkinson's is going to visit their neurologist. So that creates a very difficult picture for the neurologist regarding his evaluation or her evaluation of us. So in an attempt to make the diagnosis easier in the early stages and to standardize things, the National Parkinson's Foundation outlined the 10 most common early warning signs that suggest that you or I might have Parkinson's. And here they are in summary. First, tremor or shaking greater on one side. Number 2, small handwriting. Number 3, loss of smell. Mostly reported as loss of ability to taste food, believe it or not, because most of the component of tasting food has to do with smell and not taste. Trouble sleeping. Not falling asleep so much as staying asleep. Parkinson's people tend to wake up early, usually after 2 or 3 hours. Trouble or stiffness in moving or walking. Constipation. Soft or low voice. Loss of facial expression or mask faces. We're not as expressive as the average person. Dizziness and fainting. And stooping or hunching over. That occurs more in older patients who get Parkinson's. But notice that only 5 of these 10 early symptoms involve disorders of movement. Then we're going to mention 2 additional symptoms that frequently occur in early Parkinson's. Excessive daytime sleepiness and new psychiatric disturbances, particularly problems with anxiety and depression. And they can appear as early as 3 to 5 years before any movement problems show up. So that's it for part 1 of Do I Have Parkinson's Disease? Part 2 will involve more of taking a look at how a neurologist actually evaluates this. This is Marshall Davidson for Dopadoc.com. Thank you.